大家好, I'm Nathan Rich, aka 火锅大王. You know, for 7 months I've been working on a timeline. I'll probably make this timeline available to my Patreon, Subscribestar, and PayPal subscribers. So if you're one of them and you want access to this timeline to check the sources or recommend some changes or add things, that type of stuff, please let me know. In the meantime, let's get started. On the 20th, only 7 states have limited mask requirements. Florida beaches open after a death spike, massive underreporting, rampant mismatched reporting methods. USA Today says antibody tests could be the key to reopening the country. Remember this report. Atlantic, masks give a better chance of avoiding infection and a better chance of contracting only a mild illness. A survey shows that 92% of frontline nurses say the federal government is not doing enough to protect the healthcare staff. 82% say there's not enough protective equipment, and 85% say they cannot get COVID testing quickly and effectively at their hospital. The Paycheck Protection Program and Healthcare Enhancement Act is enacted. More Americans scamming people, peddling millions of non-existent masks. Coronavirus death toll is far higher than reported, over 1 million cumulative cases. A study suggests that the deaths are 1.5 to 3 times higher. April 30th, the end of federal social distancing. But some airlines are requiring masks. Deaths are off by perhaps 50%. NIH cuts coronavirus research funding. The White House bans Fauci from testifying about U.S. response. The White House is now predicting that deaths will stop in September. And remember when USA Today suggested that antibody tests could be key to reopening the country? Well, now they're saying, don't get antibody testing. Over 1 million active cases. The US blocks a UN request to end hostilities during COVID-19. And states begin loosening restrictions May 11th.
Well, they're losing their lives everywhere in the world. And maybe that's a question you should ask China. Don't ask me, ask China that question.
Armed militia-style protesters have helped businesses across Texas defy coronavirus lockdowns and reopen. FDA halts Bill Gates' coronavirus testing program. CDC and state metrics don't match. And May 18th begins widespread reopening. Thousands of people gathering. All 50 states have eased coronavirus restrictions. CDC says they're being muzzled, and it's reported that the CDC is distorting metrics and other mistakes, and they're overstating their ability to test. 100,000 people are dead, and right around here is where we reach about double the deaths of the seasonal flu for the same amount of time. This is also the beginning of a lot of unrelated protests, so now we have sort of 2 waves of protests happening at the same time. Thousands are disregarding health advice. Coronavirus may never go away even with a vaccine, and many businesses ban masks. The US, which has fallen deep into debt to the WHO, ends the relationship. As you can see, things are just kind of slowing down. By the time June rolls around, there's really not that much happening anymore, which is kind of interesting because here in China, in June, this is the first time that I noticed some people here in Beijing weren't really wearing masks, and they were kind of letting people in more easily and not really checking you that much, and the kind of defenses were going down. There were almost no cases at all. If we look at the graph in China, we can see that, as I said before, February was the peak active cases. And by June, it's barely even triple-digit cases in the entire country. Despite warnings, the US wasn't prepared with masks for coronavirus. Now it's too late. And this is absolutely correct. By June, it's just way too late. There's really nothing that you can do anymore. It's going to be a full-blown, fully hitting pandemic inside of America, because there really hasn't been any action other than confusing everybody and telling them not to wear masks and telling them all to gather and everything's going to be fine, and then eventually shutting things down, but then quickly opening them back up. So USA Today is absolutely correct. It's way too late as of June. Most states are underreporting cases, more enormous parties and protests. The CNN says the best way to reduce coronavirus transmission is by wearing a face mask. The CDC clarifies the mask guidance. They're not regulations, they're not commands, but they are recommendations or even suggestions. And in what is for some reason not the #1 item on every newsreel forever from this day forward, Fauci admits intentionally misleading about the masks. A Seattle man is billed $1.1 million for his treatment. He probably won't have to pay most of that, but gives you an idea of who may be profiting from this type of thing. Reuters says the US is divided over masks. Yes, the media is telling us that we're divided over masks, but why? And this is just one little interesting piece of insight into the American mindset with some people. Aubrey Huff, who's a former athlete, says, quote, "I'd rather die from coronavirus than live the rest of my life in fear and wear a mask." It just sounds so good, doesn't it? I mean, yeah, freedom. I don't want to live the rest of my life in fear and wear a mask. I'd rather just die from the virus. The problem there, Aubrey, is that those aren't the options. The options are wear a mask and live with or without fear for some months and have a much less chance to die or kill other people around you from this virus, or ignore that and have a much higher chance to kill people around you. That's really the actual choice, because the mask is mostly for you to not infect other people. It does reduce your chance of getting infected, but it much more reduces other people's chance of getting infected. It's not really about the government trying to control you and make you live in fear and all this stuff. It's about, do you really want to kill your parents accidentally? No, I mean, why risk it? Wearing a mask is not that big of a deal, and you don't have to live in fear. Just live in precaution, or huge gatherings. And then almost daily record case counts. Here, the CDC, not some crazy conspiracy theory website or whoever you think is a not valid source of information. The CDC says there are approximately 24 million cases in the United States as of June 25th, 2020. That's not me saying it, okay? That's the CDC saying that. Culturally, the US wasn't prepared to wear masks. Washington state's face mask requirement starts. This is just one example, so some places did locally have some requirements. CNBC, coronavirus mask mandates differ across the country as hotspots multiply and states play politics. CDC says over 90% of cases are unreported. Only a fraction of cases being reported. Vice President urges masks. June 29th, Yale says that the cases are substantially undercounted. Officials are caught hiding meat factory cases, presumably to try to avoid a panic surrounding meat purchases. Trump says we're headed back in a very strong fashion. People are reportedly getting COVID on purpose. More large gatherings and parties.
One of the men who threw this party says he's not too worried about spreading the coronavirus. He says he'll wait to see if there's a spike in cases.
80% of states' cases are rising. Meanwhile, Trump says we have the lowest mortality rate in the world, which is completely not true at all. July 9th, 85% of nurses are made to reuse their masks. Washington Post says supplies are desperately needed. And July 11th, the president finally wears a mask. Cases are surging because the nation, quote, didn't totally shut down. Deaths continue to be underreported in every state.
New report from the CDC revealing the number of infections here in the U.S. is likely 10 times higher than reported.
The president says COVID, quote, will probably unfortunately get worse before it gets better, which is absolutely correct. CDC reduces isolation from 14 to 10 days in most cases. Many more gatherings. Cases are probably 10 times higher than the official numbers. Cases are being underreported. Enormous, huge gatherings of people, Sturgis, prayers, concerts, protests. Texas, as just another example, is underreporting cases. Iowa, another example, improperly backdating test results. Fox reports that Facebook misinformation has reached 3.8 billion views. I wonder if they even considered "don't wear a mask" as misinformation. CDC also says it's up to each individual to take the responsibility to embrace the importance of wearing a mask, social distancing, washing your hands, and being smart about crowds. CDC says we know wearing masks works. CDC, schools shouldn't close if someone gets COVID-19. Lack of COVID-19 safety protocols in the White House. Several states are not adhering to CDC guidelines, and obesity is linked to the death rate. High amounts of healthcare professional infections are going undetected. There's a shortage of masks, other PPE, and 50% more medical personnel infections are due to this shortage. Ex-health officials urge states to abandon CDC for, quote, promoting policies that will prolong the pandemic. Trump interfering with CDC reporting. Many states are underreporting testing.
More than 200,000 people in the United States have now died after contracting the coronavirus. It is the highest number for any country in the world, even though the U.S. accounts for only about 4% of the global population.
More underreporting of cases. New York Times says Trump is the single largest driver of coronavirus misinformation, although it may be a close race between him and all the media who repeatedly told people not to wear masks, which apparently was coming from the CDC. So I don't know if it's the CDC or Trump, but definitely he's up there. A nurse union accuses CDC of underreporting cases, and this is around the time that the amount of deaths from COVID were about triple that of the seasonal flu. October 2nd, Trump becomes infected, and October 5th is when the CDC admits that it's airborne after much going back and forth and several months of scientists trying to pressure them into doing so based on strong evidence. The WHO says 95% of worldwide cases are unreported. 95%. October 12th, 12 states are reporting record coronavirus case counts, and it's found that the virus can survive up to 28 days on surfaces. And you'll notice that kind of towards the end here, there's not really much going on. It's just huge gatherings of people reporting issues, mistakes, problems. There's not really many solutions. So looking at this entire thing, I think that there was about 1 or 2 periods of some activity. There were a few good things that were done. The travel bans were okay. They weren't great. The stay-at-home orders were okay, but they really didn't last long at all. Overall, I'd say that this handling of the virus was slightly better than the H1N1, because if you remember from that video, the H1N1 outbreak was handled by America basically by just ignoring it, pretending it didn't exist, letting it spread and spread and spread and spread, just saying things like, oh, it's too late, it's just gonna spread, there's nothing we can do about it. And then eventually saying, oh, that was actually way more rampant than we told you at the time. They underreported by massive amounts the entire time, lied to the American people again and again and again and again, and eventually just sort of quietly said, oh yeah, we were lying the whole time, and they escaped any sort of punishment for that. This time is a little bit different. They're not ignoring it like they did with H1N1. What they did with this outbreak is they bombarded everyone with a bunch of conflicting information. If you were an American during this time, most of the information that you get would be very confusing, contradictory. You get information from one news outlet that contradicts another one, or even contradicts something that they just told you a few days before. So the biggest problem with this that I can see is it was very, 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 very slow, way slower than China. And the second problem is there's no actual power from the central government. And so it's just left up to the states. But the problem is the virus doesn't care what state you're in. So it just spreads around. So that basically reduces all the states to the safety of the lowest common denominator. So whichever state has the worst regulations will be the general safety level of all the rest of them, unless you actually block your state off from other states, which would be totally unprecedented. This really highlights a weakness in the model of the American government, which is that while it's in some ways nice to have a federal government that doesn't have much power in some cases, this is clearly a case where you actually want them to be able to lock things down and control the outbreak. If the government wanted to do nothing about it and treat it like the H1N1, it would have been nice to have a uniform direction to do that and to just say, well, screw it, we're just going to let people die so the economy lives. Or if they were going to really lock things down for a few months and then be fine like China is, then they should have done that more deliberately. The real issue with the way that America dealt with this is that it's just this chaotic, confusing message where things are being locked down and then opened up, and then some places aren't opening up and some are staying locked down. It's very, very disorganized, chaotic, and confusing, which in times of a pandemic or like a war or any real big tragedy, catastrophe, this type of thing, that's the last thing that you want, because everyone just gets sick and dies. Here in China, by the way, for quite some time now, you don't really even need to wear a mask in most places. A lot of people still do out of respect, out of precaution, but it's nothing like it used to be. We don't really have any cases. So to see my home country go through this is really sad. It's really sad to see so many people die because they haven't chosen a strategy. So you kind of get the worst of both sides. You don't really lock everything down, but you still get the economic hits. You lock some things down, but you don't really mitigate the damage. It's not really a matter of me telling you that they should have locked down or shouldn't lock down. It's just more of like, there should be some uniformity in how to deal with this. Anyway, that's just my opinion. If there's anything you think I missed, please let me know. I didn't include every single large gathering and every single everything, but I did try to make this a pretty balanced way to look at the United States reaction. All in all, it was a big disappointment. It was slightly better than H1N1, but I think it could have been done so much better. And I know we're all hoping that this thing clears up and everything can return to normal like it has here in China. So until next time, thanks everybody. 谢谢。